Remember the great swine flu scare earlier this year? Well, all over the United States, our neighbors have started to roll up their sleeves and begin inoculations. Here in Canada, we were to have begun our immunization in September. But what's happening? When do we start our flu shots? Or were the critics correct? For a total program estimated as high as $50 million, just what are we getting? It's October now, and autumn sees the start of the flu season. With a nostril velocity of 120 miles an hour, the nose is the most efficient influenza spreader. One sneeze fills the air with thousands of droplets and millions of bacteria. When news of swine flu reached Ottawa early this year, the government was swift to act. The House of Commons was told of a plan to vaccinate 11,600,000 Canadians, not only the old and sick, but the young and healthy too. The vaccine alone could cost $12 million. But now the corridors of power are resounding with the footsteps of politicians and bureaucrats scurrying for cover. It looks as though 80% of the money they've already spent may be wasted, and confusion reigns. We've been telephoning the provincial health departments all across the country and asking them, do you think you'll go ahead with the mass immunization program for swine flu? And they reply, what do you think? We've been trying to find out how this could all have come to pass. It all begins in the United States with the death of one young man. This is 19-year-old Private Lewis, the day he joined the United States Army.
Fires, tuck yourselves into a good, prone, unsupported firing position.
David Lewis spent the last day of his life learning to use an M16 rifle.
And commence firing.
Lewis was a new recruit on a basic training course at Fort Dix, New Jersey. He was to be the first and only victim of swine flu this year. Only 11 other cases have been definitely confirmed.
I realized it wasn't an ordinary cold or flu.
Lloyd Berry recalls the symptoms of swine flu.
Well, I felt a little dizzy at first. It started off with dizziness, headaches, colds, and chills.
Lewis had ignored doctors' orders to rest in bed. Doubling back from the rifle range, he collapsed and died shortly afterwards in the camp hospital. The flu rife in Fort Dix was not swine flu, but the current most common influenza virus, Victoria A. Army Dr. Colonel Leon Dixon.
At the time, we weren't aware that this was swine flu. It was only after the isolation of the organism during probably the early part of March, middle of March, that we became aware of the fact that there had been a problem here at Fort Dix.
At Fort Dix, someone like Lewis dies of flu complications every 2 years. What was unusual about Lewis's death was the virus that killed him. The mysterious strain of flu that killed Private Lewis was brought to the National Center for Disease Control in Atlanta, Georgia. It was finally identified technically as A. New Jersey 876, commonly known to us as swine flu, a strain of influenza that has not been seen in a human outbreak in the United States since the early 1930s. The discovery was made by the staff of Dr. Walter Dowdle.
They really did a good job up there in suspecting that it was a different virus. They sent it down here, and then in a matter of about 5 days, it was identified as an influenza A virus, and then identified as a swine-type virus.
Swine flu, as its name suggests, is a disease that's common in pigs. It has been known to affect pig farmers, but analysis of blood samples taken in Fort Dix showed that now it was passing from human to human.
As time went on, we realized that this could be a very, very serious problem.
Why could it be so serious?
Because this virus is essentially new to the bulk of the population in the world, that individuals over the age of 55, most of those over the age of 55, have antibodies to this virus from a previous exposure, about 1918 and into the 20s. But those under 55 have no antibodies to this virus at all, so therefore it could cause a rather sizable pandemic.
The worldwide flu epidemic of 1918 killed more people than the First World War. Victorious returning troops brought the virus to Canada. It traveled west with them, infecting 1 Canadian in 6. Above all, it struck down those aged from 20 to 50. They called it Spanish flu. The epidemic has been compared to the plagues of medieval Europe. People wore white masks and hung raw onions and garlic around their necks. Like the medicine of the day, they were of little use.
I remember the atmosphere in particular, the feeling of doom all over Winnipeg. I'm sure
Mrs. Grant Dexter.
For me, every hour you'd hear of some other person who had come down with the flu, and with nothing to prevent or to aid in medication, it was really a very scary business.
Did you have friends who died?
Yes, I did. I had several friends who died, and the doctors were dying because, of course, they were overworked. You couldn't get nurses. There were so many tragic things happened. I was talking with a friend of mine the other night, and he said that he had been driving doctors around. They came to one house where he had been called the previous day, where there were 5 children, and by the time the doctor got there, 4 of them had died. You know, it was an incredible experience.
Remembering 1918, President Ford decided to vaccinate 200 million Americans, man, woman, and child.
This virus was the cause of a pandemic in 1918 and 1919 that resulted in over 500,000 deaths in the United States, as well as 20 million deaths around the world.
Cynics called it an election gimmick, and right from the start, some American scientists were critical. The director of Ralph Nader's health research group, Dr. Sidney Wolfe.
Well, we don't even know what the virus was like in 1918 because there were no isolation methods. What we do know is what a swine-like virus in 1931 looked like, and the comparison is really to that 1931 virus, so that no one has even gotten a piece of that 1918 virus to make that kind of statement, so which makes it all the more specious a comparison.
Well, I don't think there's any doubt that 1918 and the association with 1918 certainly adds to the drama of the whole thing. And I doubt very seriously if we'd have gotten the same news coverage if it had been just a different virus and not related to 1918.
One can seriously question as to whether or not the program would have galloped off as quickly as it did in the United States or in Canada had this 1918 scare tactic not been used.
Now Ottawa was infected with Washington's enthusiasm. Everyone over 65 and the chronically sick would receive vaccine.
There is not a single dose of vaccine in the whole world at the present
Clearly
time.
mindful of 1918, Health Minister Mark Lalonde stressed the risk to everyone aged from 20 to 50. They too would get swine flu shots.
There's no need or no ground, obviously, for panicking.
Lalonde's chief advisor in the department is Dr. Alexander Morrison.
There was no time to do definitive laboratory studies other than to follow very closely what the Americans were doing.
So that basically the decision was based on what the Americans had found?
The decision was based on the evidence in the United States that a swine virus had been isolated from a human host.
Did anyone from Health Protection here go to Fort Dix, for instance?
We did not go to Fort Dix. We really were in very close contact, though, with the American scientists who were at Fort Dix.
But was the government overreacting? Toronto epidemiologist Dr. Harding LaRiche.
It was a political thing to start with, and I suppose that the Canadian federal government didn't have the courage to come to its own conclusions. I don't know. I can't tell you, but I'm worried about these panic-stricken reactions.
I guess there was sheer panic when the first phone call came through.
Dr. Stephen Voss is a microbiologist in Montreal.
When I first heard of it, I was a bit skeptical, just like most of the people. We didn't quite understand the whys and hows of this epidemic.
The late-night flight from Melbourne. We can't produce our own vaccine, so we buy from abroad. And as Canada and the U.S. are the only 2 countries contemplating mass immunization, there are plenty of sellers. George Neves is here to clear the vaccine through customs. Each carton is worth $150,000, so though he's international manager of Connaught Labs, Neves feels his presence is justified, even at midnight on Saturday. Though it's duty-free, he's a man with a lot to declare.
Between $300,000 and $400,000, I would say, roughly.
As long as the proper forms come over with it, there's usually no problem at all.
This one came from Australia, and we are also importing it from Holland and Germany.
It was hoped to have the vaccine here by September, but some provinces may only get their supplies in time for Christmas. 2 cartons have failed to arrive tonight.
Unfortunately, they couldn't make it. They are delayed a week, I think.
Luckily, it's only a trifling amount.
Well, there's 160 million units.
The vaccine has to be driven straight to the labs before the ice in which it's packed can melt. Only 2 companies can handle an order like this. The Armand Frappier Institute in Montreal is one. The other is the Connaught Labs in Toronto. To produce a vaccine, fertilized eggs are injected with the virus. The virus grows in the egg, killed with formalin, and made ready for injection. If you're allergic to eggs, the vaccine could give you hives, asthma, or even severe shock. The finished vaccine reaches Canada in concentrate form, but the laboratories here must first dilute it and then test for purity. But however pure the vaccine, it can still produce side effects. These are too severe for children, and no one in Canada under the age of 20 can yet be given swine flu shots. The vaccine's been tested on a few volunteers.
I didn't have any reaction at all. In fact, I didn't know that I'd been vaccinated.
3% of those tested showed side effects.
Yes, the chap in the office next door had a temperature. Well, some people do. You know, if you give 1,000 people a glass of water, one of them's going to choke on it.
And so another precious consignment of vaccine completes its perilous journey.
We can hit that doorway all right? Anyway, it'll soon be safe inside. Okay.
Although Ottawa conceived the swine flu program, it will be paid for and administered by the provinces. Ever since the Ontario government agreed to the federal plan, Dr. Gordon Martin, the province's chief medical officer, has been in charge of it.
The original plan was to provide vaccine to 3 target groups. First of all, the age 65 and over. Secondly, those persons with chronic disease. And chronic disease was defined fairly broadly to involve mainly those with chest conditions and with chronic heart conditions. Both these groups were to receive a product that contained the antigen to both the A New Jersey, or the swine flu, and to the A Victoria, which is the prevalent strain of the last year or two. There was then a third group, namely the 20 to 50-year-olds, who were to receive the injection which contained antigen only to the A New Jersey.
Keith Fitzgerald, who actually implements the plan, cracks a bitter smile.
I would bet that the chances of swine flu occurring in Canada, indeed anywhere in the world, are probably rock bottom.
Dr. Fitzgerald's been planning swine flu clinics in schools and civic centers and letting nurses rehearse the $1,000 vaccination gun on kids getting routine polio shots.
You just clean the arm and away you go.
For local health officials, the last 6 months have been chaos. Where was the vaccine coming from? How much would they get? Who was to get it first? And when was it coming?
So everything is at last ready for the great day, but the great day may never come. The part of the proposal that really grabbed the headlines was the fact that they were going to immunize everybody between the ages of 20 and 50. And that's precisely the part of the program that may never happen.
The provinces are wondering if the Americans have cried wolf. From a computerized control room in Atlanta, Dr. Don Millar has been monitoring every outbreak of flu in the world.
We've done more extensive surveillance this year than ever before in history. There has been flu in the southern hemisphere in substantial quantities, but it's all been A. Victoria or other influenza A types. None of it has been swine influenza.
In Canada, Harding LaRiche has been reading the results of some British research.
The British actually tested the Fort Dix virus on people, on 6 people.
How sick did these human volunteers become when they carried out these tests in England?
They concluded that it was not quite as virulent as the existing A viruses, a little more virulent than the ordinary swine viruses, which are not very virulent in man.
When you use the term virulence, what do you mean?
By virulence, I mean the capacity to produce disease. In other words, a killing type of organism. Now, everybody has assumed because of the word swine that this is a terrible thing. I would think that it had been called mouse virus, nobody would have worried too much.
Of the 21,000 men at Fort Dix, swine flu killed only 1. There were 11 confirmed and 500 suspected cases, but all recovered completely. No Canadian health official has talked to the only doctor in the world with first-hand experience of swine flu.
Certain individuals had the swine flu, and others had the Victoria flu, and others had just a common cold. But basically, as we look back now, there was no way of differentiating the individuals at all.
The man nobody's talked to is Dr. Leon Dixon.
They were these individuals who had the swine flu, as we look back in a retrospective analysis of their records, were no sicker than any other patients who were in the hospital at that time with other illnesses, respiratory illnesses. In all probability, it was not as contagious as some of the Victoria flu because it was fairly well isolated for a period of time. Let's say from about the 5th of January until about the 17th of February, we had a problem here at Fort Dix. From then on, the problem ceased. Victoria flu continued on beyond that. From our experience in this hospital, we would have to say it was not any more dangerous than the Victoria flu or any other type of flu.
Frappier in Montreal have been processing vaccine for both flus, Aurel Beaune.
In fact, we've been stating all along that the need to protect Canadians against the Victoria type virus is perhaps as important, if not more important than against the swine type virus. Provinces have finally seen the light.
When Victoria A hit Canada this March, 1,000 people, mainly the old and sick, died in a month.
Because the United States government and to a certain extent the Canadian government commandeered the production facilities for a vaccine, the normal vaccines that would have been used this fall for these programs are not available.
So if our efforts to prevent swine flu will affect our annual effort to reduce influenza A2 disease, that is a real danger.
One by one, the provinces are reaching the same decision. Give the bivalent vaccine to the old and the sick to protect them not against swine flu, but Victoria A. As for the rest, do nothing until an outbreak of swine flu occurs. 80% of the vaccine they bought was meant for those aged between 20 and 50. It will stay on the shelves. The provinces call it stockpiling. The federal flu strategy may be in ruins.
Yes, I understand that their provinces are having second thoughts, and of course that's their privilege to do so. What's going to happen in the future? No one knows. We do know that since February there has not been another human isolate, but we know that there have been isolations in 3 American states of the swine virus from pigs, and that there have now been reports of swine virus being isolated from pigs in Southeast Asia, so that we know that the virus has simply not gone away and died someplace. It's out there in the swine reservoir. Whether it will ever again jump to man and be transmitted from man to man, we don't know at this stage of the game.
No, I have some sympathy for the feds on this. I remember last winter when they were debating it in Parliament, and the pressure from the opposition was simply, could they get enough vaccine in time? Had they decided to risk it and that anybody died or the epidemic broke out, it would have been a political catastrophe.
Political is the key word. It became a political problem rather than a health problem, and that's what, in effect, it still is. Stockpiling is just the worst possible answer at the moment because they're keeping it on the shelf. They don't know what the shelf life of it's going to be. By the time they implemented the program, the flu could have swept the whole nation. At this point, we've got the worst of both worlds.